In this episode of EHA Unplugged, we will revisit a spotlight talk from EHA 2024. Professor Domenico Girelli from the University of Verona will discuss the complex relationship between iron metabolism and infection.
My name is Domenico Girelli. I am professor of internal medicine at the University of Verona, and I have a long-standing interest in iron metabolism. The title of this talk is Iron and Infection, Back to the Future, because this story is very, very long. And first of all, I would like to recall you about one of the most important problems that we have in healthcare nowadays. That is multidrug resistance to antibiotics. According to several agencies, including the WHO, but also including our European community, MDR resistance is one of the major healthcare problems in the coming year, and it is predicted to become the leading cause of death, especially for patients in the hospital. This is the reason why the WHO has endorsed the so-called One Health approach. That means that we have to take care not only of our health, but also of the health of the planet and the health of the animals, because, as you know, most of the multidrug resistance is due to livestock. So we have to take care on the planet, on ourselves, and also of animals. And the awareness of the iron infection interaction could help us in fighting this rising problem. So, according to Otto Warburg, the Nobel Prize winner in 1925, life without iron would be impossible. And as a matter of fact, iron was essential for the development of the first forms of life in the Archean Ocean, but also iron is essential for all living organisms, including the microbes, and it is relatively scarce. So, as you will see, there is, during an infection, there is a sort of battle for iron between the host and between the pathogen. So we, as hematologists, are in the habit of consider iron important only for the synthesis of hemoglobin and the iron storage in myoglobin in muscles. But iron, due to its oxidative properties, is actually essential for many other vital functions, and including the production of energy in the mitochondria and the synthesis and the repair of DNA that is crucial for cell proliferation. So you can imagine that during an infection, we have from one side, iron is needed to the microbes in order to grow, and from the other side, iron is needed to our immune system in order to mount an immune response against the invading pathogen. So there is a battle in this sense. A key role in this context is played by hepcidin. All of you are aware that hepcidin is the most important regulator of iron metabolism, by inhibiting ferroportin, but you have to consider also that hepcidin is very close from a chemical point of view to the defensins. Defensins are small peptides that are produced by leukocytes, by neutrophils and other cells, and are the first line of defense against infection because they have an antimicrobial effect which is direct. But hepcidin also have an antimicrobial effect that is indirect by subtracting iron from the invading pathogens. During an infection, for example, from a gram-negative bacteria, we have the production of LPS, and then the stimulation of the immune cells to produce interleukin-6 that stimulates the production of hepcidin in the liver, and hepcidin block ferroportin in the macrophages, and in this way, iron is not available to the pathogen. And this, of course, is one of the main mechanisms that is involved in the so-called anemia of inflammation that in this sense can be considered like a byproduct of the response of an acute infection. There are other ways in which our body responds to an infection. Not only the synthesis of hepcidin that is stimulated by interleukin-6 and many other interleukins, but also our immune cells secrete some molecules that are named siderophores that are characterized by the high affinity for iron. On the other side, the bacteria also produce a number of siderophores in order to catch up the iron. Among the human siderophore, we have lactoferrin, we have lipocalin, and many other molecules. And each different strain of bacteria produces its own siderophore, and in order to acquire iron. So this is the basis for the synthesis of a new class of antibiotics that could help in responding to the problem of the multidrug resistance. This is a kind of a Trojan horse strategy because, for example, there is a new antibiotics that is similar to the classical cephalosporin that is named cefiderocol. Cefiderocol is a beta-lactamine that is conjugated with a siderophore. And these allow the entry of the antibiotic within the bacterial wall, because in the bacterial wall there are some specific receptors for the siderophore, and then when the antibiotics is inside the cell, the antibiotic is released and can act against the pathogen. So this is a new class of antibiotics. Cefiderocol is the first in class, but there are many other products that are under developing. From the other side, we have to consider also that whenever we have an infection, our immune systems have to respond, and B lymphocytes and T lymphocytes have to proliferate and need a lot of energy in order to produce, for example, antibodies. So during an infection, our immune system needs iron, and in condition of iron deficiency that could be pre-existing the infection, we could have diminished immune response because of the iron deficiency. And this may represent a cause of an altered response to vaccination. Indeed, there are some examples of these problems. In the last 2 years, some papers have been published by the group of Al Drakesmith and Nicole Stoffel at the Oxford University. They have done a lot of work regarding the role of iron deficiency as a possible problem in mounting an efficient immune response to several vaccines. And indeed, it has been demonstrated in children from the Ghana in Africa that pre-existing anemia or iron deficiency can lead to a decreased response to some vaccines, especially against pertussis, against diphtheria, and against pneumococcal infection. Similarly, also in elderly individuals, it has been reported that the response to the influenza vaccines may be diminished in conditions of iron deficiency. Another point, and my last point regarding the complex relationship between iron metabolism and infection is regarding the role of common iron disorders that can influence the immune function. This is an active field of research. As you know, iron deficiency is one of the most frequent diseases on a global perspective. It has been estimated that about 1/3 of the world population is affected by anemia, and the majority of anemic subjects actually suffers from iron deficiency. And in this condition, as I said before, that could be an altered response to some vaccines, but there is also a rare disorder that is characterized by mutation in the transferrin receptor that is expressed in all cells, but also, of course, in lymphocytes. And patients with this defect are only mildly anemic, but actually they are immunodeficient. And this is a sort of proof of concept that iron is really important for mounting an appropriate immune response. On the other side, iron overload is also a condition that is characterized by some alteration in the immune response. And recently, it has been published a very good paper on blood that was presented the last year here in EHA, in which it has been demonstrated that people with hemochromatosis are more susceptible to infection. And another point is that they are especially subjected to infection by Vibrio vulnificans, that is a microorganism that is present in the water. And so from a practical point of view, our patients with hemochromatosis should be advised to avoid contact with contaminated water, especially if they are if they have wound. So, in conclusion, I hope to convince you that the host pathogen battle for iron is key for the outcome of most infectious disease. I have shown you the novel metallo-antibiotics that represents an attractive option for MDR pathogen. Both iron deficiency and iron overload are risk factors for an impaired immune response to pathogens and vaccines. And of course, further research is needed in this field. But if you consider the global prevalence of anemia and iron deficiency and the burden of vaccine preventable diseases, even if iron deficiency only moderately diminishes the effectiveness of a subset of vaccines, counteracting iron deficiency could yield significant benefits. Thank you very much for your attention.
I want to know about your idea about iron prescription for the inpatient setting for anemia correction and also with concomitant infection. Do you suggest?
This is a very, very important question. Thank you very much. In principle, I think that we should avoid giving iron even if the patient is iron deficient, whenever there is an active infection, okay? So we have to cure the infection and then give iron.